Dr. Chris Ethridge. Now, Chris is a leading medical herbalist, a phytotherapist with extensive experience as a herbal practitioner, researcher, and writer. Chris is the chair of the British Herbal Medicine Association, BHMA, and the president of the European Herbal Traditional Medicines Practitioners Association, the EHTPA. Chris, over to you.
Thanks, Naveed. Right, let me just share my screen. Is that all clear? Yeah.
Absolutely spot on. Perfect, Chris.
Perfect. Righto, brilliant. So as Naveed said, I'm going to be talking today about herbal medicine, often called phytotherapy. And just a little picture there of a plant that's dear to my heart. For those of you who don't recognize that herb, that's echinacea. That's one of our key herbs we use, certainly in the UK. Well, Naveed's kind of introduced me, but I'm a medical herbalist. In particular, I work in Western medical herbalists. There's different types of herbal medicine, as I'll talk about in a few minutes. And I'm very, very honoured and lucky to be involved with quite a few different associations, which are listed here. If you want to know more about them, what we do, please do click on the links there. And as with the other presentations today, I'll be running through with herbal medicine some definitions, the origins, how it works, uses, benefits, how it works with conventional medicines. And at the end, I'll give a very quick case study as well. And not with any graphic pictures, unfortunately. So sorry, Tariq. I loved your pictures, but I haven't got nasty pictures. You'll be glad or perhaps unglad to hear. So let's look at some definitions. Herbal medicine or phytotherapy is defined as the practice of using plant material for food medicine, health promotion, and it is the oldest form of healing. As I alluded to, there are a number of different types of herbal medicine that are currently being practiced in the UK, including but not limited to Western, Chinese, Ayurvedic, Tibetan, also Unani Tib, and various others. And because in the UK, herbal medicine isn't statutorily regulated, it is voluntary regulated by a number of separate practitioner associations, so lots of abbreviations, but the CPP, the OHP, RCHM, BATTM, LMH, AMH, and many others. There's probably about 18 different practitioner associations, which is good in some ways, but makes things very complicated in other ways. And let's talk about the origins of herbal medicine. It's interesting looking backwards. The evidence for the use of herbs being used as medicines, not foods, by humans has been found from before recorded history, at least to the Paleolithic era, so at least 60,000 years, which is quite mind-boggling in some ways. However, perhaps not, because there is now emerging much evidence that a number of other animals self-medicate using medicinal plants. It's been seen in the great apes, the chimpanzees, orangutans, gorillas, bears, deer, elk, goats. Lots of birds self-medicate, elephants, and even lizards have been shown to use different plant materials to treat certain issues, which is fabulous, isn't it? And there's been a lot of research published about this, which you can look about it if you want to. From a written evidence point of view, the use of herbs has been documented going back sort of 5,000 years ago. The earliest examples of written evidence is from the Sumerian culture, from stone tablets. And the identification and documentation of herbs and their uses, again, have been really carried out for many, many, many millennia. Egyptian, Ayurvedic, Chinese, Greek, Roman, Arabic. And in those different cultures, extensive materiae medicae were recorded and actually are still available now, which again is really interesting to read. And this is a difficult question. What's the philosophy of herbal medicine? The underlying philosophy of herbal medicine, like many natural treatments, is that nature provides, in herbs in this case, all that we need to treat and prevent illness and to restore good health. And this is called the healing power of nature, the vis mettatrix naturae. And importantly, within herbal medicine, the herbs must cause no harm to the patients. There are herbs that are good. There are some herbs that are quite toxic, obviously, and can't be used internally. And these herbs should work in harmony with the body. They shouldn't be sort of forcing the body to do things it doesn't want to do. It should be making the body self-heal, supporting the body in healing itself. And that's really, really, really crucial. And just a lovely quote here, I think, from Rudolf Steiner, who was an Austrian practitioner back in the last century. And he sort of wrote, for every human illness, somewhere in the world, there exists a plant which is the cure. I believe that there is a healing potential locked inside plants, which is integral with their evolution, just as it is part of human evolution to learn to tap this wonderful gift of nature. So that's really inspiring and really, I think, encompasses what herbal medicine is about. Going into a bit more of the nitty-gritty, so herbal medicine is used to treat both the symptoms, but more importantly, perhaps the underlying causes of different disease states. And that's by primarily boosting the body's fundamental ability to self-heal and to restore rather the normal equilibrium, the homeostasis within the body. And the actions of the herb are considered in terms of their unique chemical components. And it's this unique, specific combination, the fingerprint, if you wish, the chemical fingerprint of these different components within the herb, which are directly responsible for the actions of that herb on the body. And each herb is slightly different in its phytochemical fingerprint, so has different effects on the body. And just for reference, I picked some herbs from my garden here for you who can see this here. This one here is a well-known one. This is chaste tree, Vitex agnus castus, which is used for hormonal issues such as PMS. We have St. John's wort here, this little one here, just out of flower now, a few yellow flowers we look. But as Trig mentioned, it's used for sort of nervous pain. It's also used for anxiety and stress. And of course, in modern terms, it's used for mild to moderate depression as well. Another little one here with a beautiful blue dandelion-like flowers, that's chicory. The leaves are very bitter and are used to stimulate digestion, to aid sort of indigestion, IBS, that sort of thing. The roots of chicory are very rich in compounds called inulin, and these are probiotics. So they're good at feeding the good bacteria in our gut to support a good microbiome. And lastly, here, this little herb here with the red berries. This is cramp bark, Viburnum, and perhaps, as the name suggests, this is used for treating cramps, particularly sort of gastrointestinal and muscular system cramps. And within herb medicine, optimization of health and wellness is key, with the emphasis on the prevention of disease. And that's really, really important. It is much easier to prevent a disease than it is to treat it, as I'm sure we all know. And it's really important to treat the whole person. So we use a holistic approach. It's taking into account the body, the mind, the soul, the community, the environment. They are all absolutely essential. I'm sure that I resonate with all of you here today. And we really pay attention to the therapeutic relationship. We ensure that adequate time is spent with each patient to ensure that we thoroughly listen to them, we can thoroughly diagnose them, treat them, and educate them in a sort of collaborative way. And, when I see a patient for the first time, I probably see them for about an hour and a half, 90 minutes, which is much more than the 10 minutes that GPs have to adhere to, much to their dislike, I know. The very GPs that I know are very jealous of me when I can spend so much time really talking to the patient, finding out about them and their past medical history. And that's really important to understand the picture of what's going on, both on the surface, but also much, much deeper down within them as well. And we also look in herb medicine the importance of patient self-care. The practitioner is not there to tell the patient what to do. We're there to support them, collaborate with them, help them with their health. We're there to support them with their health. And we always treat the individual person and acknowledge their unique characteristics. There's no such thing as sort of standard formula in herbal medicine. Each patient's prescription is made up specifically for them and will differ within the same condition depending on what the patient needs, and will evolve with time. With treating patients, I always think it's like peeling an onion. You're treating them and that takes off the first layer of the onion, then something else slightly different is exposed, and you have to treat that layer and peel that off until you get to the real center of what's happening in the core of that person. And it's finding and treating the root cause of a health problem is really important, not just treating the symptoms. Though obviously for patient safety and for compliance and for their well-being, you do of course need to treat the symptoms as well. But that's the only part of the process in herbal medicine. And herbal medicine has a large number of strengths, which enables it to be used both as a standalone health modality, but perhaps more importantly nowadays, in conjunction with orthodox medicine and other complementary medicines as well on top of that, in an integrated approach. And I think that integration is so important, which is why I am so honoured to be part of the IMA, because I think the work being done here is absolutely groundbreaking. Sometimes, speaking particularly to medical doctors, that they say, well, there's no evidence for herbal medicine. That is really, really not true at all. There is a large body of published research, including some gold standard randomized clinical trials. And this evidence supports the use of various herbal medicines for a range of particularly, I would say, minor self-limiting conditions. As Naveed said at the beginning, I think it was, we don't want to use complementary medicines for treating life-threatening diseases. That's not appropriate. Those are where conventional medicine is absolutely essential. But for minor issues that would go by themselves generally with time, I think particularly herb medicine is really, really indicated and can reduce some of the burden on the NHS, which is, of course, really struggling at the current time. So just a few sort of health conditions here where there's acknowledged to be a very, very diverse and positive evidence base. Back pain, depression, particularly mild to moderate depression, I should add there. Functional dyspepsia, so indigestion, acid reflux, irritable bowel syndrome, migraines and migraine headaches, osteoarthritis, premenstrual syndrome, and very importantly, perhaps moving into the winter months and after, well, COVID's still ongoing, but after the COVID pandemic, is some acute infections, particularly the common cold, rhinosinusitis, uncomplicated upper respiratory tract infections, and things like type A and type B influenza. And generally speaking, using conventional medicine and herb medicine can work well with conventional and other complementary medicines when used in an integrated way. However, some herb medicines, particularly as I'm sure you all know, St. John's wort, can directly interact with some prescription medicines in a negative way. So care must be taken before using them. Some herbs can speed up the processing of drugs by the liver, so can make the drugs less active, or sometimes they can reduce the processing of drugs by the liver, which can cause issues with side effects. So, I'm always asked this, are herbs safe? Yes, they are, if used correctly. And some herbs are contraindicated for certain health conditions. For example, turmeric. Well, we think of that probably as a spice in curries, but turmeric is also a very important herb medicine as well. And that can't be used in patients with gallstones, because if they've got a large gallstone in the gallbladder, giving turmeric, which is a gallbladder stimulant, can push out the gallstone, and that can lead to an obstruction, which of course is a very serious condition and needs immediate treatment. So we have to be careful there with some health conditions. And as has already been mentioned before, THR licensed medicines are regulated by the Medicines and Healthcare Products Regulatory Agency and are available to buy over the counter from pharmacies. Here's one here. This is a Potter's Herbals, not giving advertising, guitar mixture. And inside there's a patient information leaflet which outlines potential interactions with drugs or contraindications. And you probably can't see here, but there's a little logo on the product, the THR. So you probably can't see here, but it's here, there, just listed. And if you see that, you know that it's been regulated by the MHRA for safety and quality, and is a very, very good standard of product to use. Not all products available to buy over the herb medicine, over the counter, rather, herb medicine wise, are regulated. For example, some, and I'm not saying these aren't good, because these are good, but some aren't regulated by the MHRA. This is a ginkgo supplement, works very well, but there's a range of different quality products on the market, some very good, some very, very poor. So you have to be cautious. For more information about THR medicines, what's available, there's a list on the BHMA website given there. And also there's a list of herbs that have been granted a traditional herbal registration, the THR, on the government MHRA website. For any conditions that are more difficult to treat, or if the patient has, who's going to buy over-the-counter medicines has any doubt, it is always worthwhile seeking a suitably qualified medical herbalist for a consultation. Herbalists are highly trained in clinical medicine diagnosis, pharmacology, etc., etc. So really know how to look at a patient, make sure there's no possibility for herb-drug interactions, etc. And herbalists are highly trained to recognize potential risks. They're highly trained to diagnose, and they'll be able to prescribe a safe alternative herbal medicine product if necessary. In my clinic, I could use something like perhaps a herbal tea, or more likely, I would use a herbal tincture, which is an extract of the herb. In this case, this is valerian, and I'll give a mixture of different liquid herbs for the patient to take a couple of times a day to help their conditions. And just here is a website you can go onto there which has a list of how to find a herbalist who's been suitably trained and qualified. And just for the last couple of minutes, I just want to go through one quick case study. And this was a 43-year-old female patient, obviously, with metrorrhagia. Metrorrhagia is very, very heavy menstrual bleeding between periods. Now, this is a red flag sign in many cases, because you have to rule out conditions such as womb cancer, endometrial cancer, for example. But in this case, the patient was assessed, and it was deemed that the cause was perimenopausal rather than anything else. So we checked for red flags, and it was deemed safe to treat this patient. And when she came to see me, I had a full consultation with her for about 90 minutes. I, obviously went through the case history, medical department history, system history, did a clinical examination to see what's going on top of everything else. And then I arrived at a prescription for her, a treatment. This was, as I said, a liquid herb medicine extract, a tincture in this case. And this contained a number of herbs. It's unusual for herbal practitioners to only use one herb. Usually we use a blend of different herbs because they tend to work very well together in a self-supporting, synergistic way. So in this case here, I used a herb called Achillea millefolium yarrow, and that's been shown to reduce bleeding and to aid uterine circulation. I used another herb called Alchemella vulgaris, or lady's mantle. And again, this reduces bleeding and is believed to be a hormone balancer from research. Another herb here, one that's used primarily in Chinese herb medicine, but now used in Western herb medicine. This is Peonia lactiflora, the white peony. And again, a wealth of evidence here showing that it reduces bleeding and is very good at normalizing hormone balance, with PMS, but also with perimenopausal patients as well. Another Chinese herb here I use a lot, Rehmannia glutinosa, the Chinese foxglove, not related to the other herb foxglove that's used for treating heart failure, so digitoxin, etc. And this is very good at reducing bleeding as well. And finally, this herb here that I mentioned earlier on, the beautiful purple flowers, chaste tree, Vitex agnus castus. And in particular, that's very good for regulating hormones and balancing them. And I'm glad to say that the heavy bleeding stopped within 2 weeks after taking the herbs, and the normal bleeding had actually resumed realistically for after sort of 3 months. And actually, even though the patient was believed by the doctor to be perimenopausal, actually she carried on menstruating normally after this, and her cycle was normal. I kept up with her, and things have been fine. I help her out occasionally for other issues, but her cycle has been normal and heavy bleeding reduced. Which is, obviously a very much a great success story for her, because it was just so uncomfortable and obviously embarrassing for her, which having severe heavy bleeding when she was out and about. And just there, you can see some pictures of all the herbs there I've used in that prescription that I discussed. Okay. So just a very brief summary. Herb medicine is a safe and effective health modality that has been used for thousands of years. It's generally most suitable for self-limiting health conditions. There actually is a significant evidence base available, and it combines well with conventional medicines as long as care is taken and instructions followed. So that's really key there. And again, back to the page here showing all the different associations that are a member of the IMA. And that is the end of my presentation. Thank you very much for listening, and I'm happy to answer any questions if there are any.
Thank you, Christopher. We just have one question, and it's more about, are there any certain type of patients or perhaps health conditions that you would not even think about using herbal medicine or telling them about herbal medicine?
Absolutely, and that's absolutely key. You know what? I actually anticipated this question, so I've got a slide that I actually will bring up here that I think is actually quite useful, if that's okay. This is one that I think is useful because there are herb medicine is incorporated within the Human Medicine Regulations 2012, so there are strict limitations on what we can and can't do. So I'll quickly just run through this. I know we're out of time slightly, but just for reference, can you see that?
Yes.
Yeah.
Has it come up with the medical herbalist side? Yeah. So herbalists are not allowed to treat life-threatening illnesses and diseases. That's under the Misrepresentations Act 1967, and of course the Cancer Act 1939. We're not allowed and shouldn't be allowed to claim to treat cancer. Also can't treat or claim to treat some of these diseases: Bright's disease, so glomerulonephritis, cancer, cataracts, diabetes, epilepsy, glaucoma, tuberculosis, STIs, locomotor ataxia, paralysis. And it's actually a criminal offence to claim to treat any of those. As I mentioned, herb medicine is best used for minor self-limiting conditions. For more major conditions such as that, conventional medicine is really the go-to.
Thank you very much for that summary and for your talk, Chris.